Hi guys, today I will be talking about the different disorders and diseases of the lymphatic system. One of them is lymphadenitis, which is an infection of the lymph nodes caused by the presence of bacteria or virus in the blood. The glands affected by this disease are the ones closest to the site of the infection. So for example, if you have staphylococcus of the throat, then the lymph nodes affected by it would be the ones near the neck. Symptoms of this disease are red tender skin over the lymph node, as well as a swollen or hard lymph node. Complications can occur if untreated through the formation of an abscess, sepsis of the blood, or fistulas. Another disease is elephantiasis, which is an enlargement of the body, especially of the limbs, due to the obstruction of the lymphatic system in which the lymph cannot leave that part of the body. It is caused by a worm which is transported through a female mosquito as it bites humans. The parasite then grows to its full size in the lymphatic system and prevents the lymph from drainage. Symptoms include fever, pain in testicles, enlarged lymph nodes, massively swollen legs, breasts, and testicles, wet urinary discharge, and a swollen liver or spleen. Another disease is glandular fever, otherwise known as the kissing disease. It is an infection caused by a virus which is spread through the contact with saliva through kissing, coughing, sharing of forks, bottles, and with children in the instance of sharing toys. Symptoms include fever, sore throat, pain of the stomach, jaundice of the skin, and a pink rash may also occur. It takes 1 to 2 months from time of infection for fever to appear, and a person is contagious from 2 to 18 months. So you could have the disease and not even know that you're spreading it. Also, a majority of the symptoms are very similar to those of a normal cold. So doctors have trouble diagnosing if it's actually glandular fever. Another disease is Hodgkin's lymphoma, which in this case is a type of cancer. It is a cancer in which cells in the lymphatic system grow abnormally and spread beyond it. It is a B cell which develops a mutation and spreads to other parts of the body. It compromises the ability to fight infections, and symptoms include swelling of the lymph nodes, fatigue, fever, chills, night sweats, weight loss, increased sensitivity to alcohol, and itching of the body. Risk factors for the development of lymphoma is ages between 15 to 30, history of the disease, gender, males are more prone to the development of Hodgkin's lymphoma, past mononucleosis infections, which is another name for glandular or kissing disease, and a weakened immune system. Another disease that affects the lymphatic system is splenomegaly. It is an enlargement of the spleen, and the spleen is an organ located in the left side of the body. It is responsible for the destroying of erythrocytes, the filtering of blood, and is also a storage for oxygenated blood. The enlargement of the spleen can be caused by liver disease, like cirrhosis, hepatitis A, B, and C, blood cancers, like leukemia, AIDS, malaria, congestive heart failure, lupus, sickle cell anemia, and abnormal blood flow. Symptoms may include abdominal pain, fever, sweating, paleness of the skin, fatigue, and weight loss. Many people think that an ectomy or removal of the spleen will not cause a change in the human body, but because of its important functions, the body will never function the same way after the spleen has been removed. Now, the last disease that I will be talking about is tonsillitis, which is very common among younger children. The tonsils are glands located at the back of the throat and are responsible for trapping germs before they get into the lungs. Sometimes these tonsils can also get infected, which is known as tonsillitis. Bacterial and viral infections can cause inflammation, but other common causes are adenoviruses, the flu, the same virus that causes the glandular fever, and the herpes simplex virus. Symptoms include throat pain, redness of the tonsils, headache, loss of appetite, ear pain, dysphagia or difficulty swallowing, swollen glands, and ulcers in the mouth. In certain situations, if the inflammation occurs at a regular basis, the tonsils may also be removed. However, there is much debate about whether or not this is a good solution to the problem. That is all for my presentation. I hope you guys enjoyed it, and I thank you for watching.